Hello everyone, welcome to my YouTube channel. So please subscribe my YouTube channel for more information and more nutritional facts. So we will discuss today about the MNT medical nutrition therapy for cholelithiasis. This is MNT for this patient who has been done his open cholecystectomy. So gallbladder of the patient is has been removed, and now patient was on 3 days on the full liquid and soft diet after the surgery. So now what diet patient will follow after having no gallbladder? As we know that now patient has no gallbladder, and patient has no gallbladder to store the bile, and bile helps in the digestion of fats and other molecules. So now we will have the low fat diet. The diet will be low in fat, low fatty acids, oils will be used in very small amounts in the diet. And the second one is medium chain fatty acids should be used. And after the surgery, small meals are recommended for the patient having no gallbladder. Small meals will help in a slow release of bile, and it will help in a digestion of food. And high soluble fibers are recommended because soluble fibers helps in the absorption of water. Patient is having no gallbladder, so bile will directly fall into the small intestine, and patient may experience the diarrhea due to the high level of fluid in it. And so high soluble fibers are recommended because soluble fibers helps in the absorption of fluid, and it will help and relieve the constipation and diarrhea. Moderate protein diet is recommended for the patients after having the surgery, and citrus fruits are recommended including lemon, oranges, because they help in reduce the LDL, which is a bad cholesterol, and prevents fatty liver, which may be present due to the gallstones. And citrus fruits are recommended, and moderate protein is recommended, and vitamin D supplements are also recommended for the patient having no gallbladder, because mostly patient complains about the back pain and pain in joints after the gallbladder removal, because if fat is not properly absorbed, so fat soluble vitamins will also not be properly absorbed. So we also recommend fat soluble vitamins, vitamin D, vitamin A, D, E, K. Vitamin D rich foods are also recommended like salmon and milk, and exposure to sunlight is also important for the absorption of vitamin D and production of vitamin D. So let's discuss about the do's and don'ts for cholelithiasis patient. And first of all, we discuss about the foods to eat. So we have to eat and plant-based foods like fruits, vegetables, legumes, lentils, beans. Fiber foods are recommended. Whole grain foods which help in reduce the LDL. Lean meat and plant-based proteins are recommended. Plant-based proteins includes lentils, beans. Vitamin C rich foods are recommended, and vitamin C present in citrus fruits like lemon, oranges, and other fruits, citrus fruits. And oils are recommended, that are flaxseed oil and fish oils. These oils contain omega-3 fatty acids, that is very important for heart, that's good for health. And nuts recommended are the walnuts and almonds because they contain good fats, so these are very important and very good for the cholelithiasis. So here are the foods that should be avoided. And refined carbohydrates like sugar, flours, white flour, sweeteners are not recommended. And unhealthy fats like fried foods contain high content of fat, that is not good for the cholelithiasis patient or the patient of fatty liver. So this is also not recommended. And red and fatty meals also contain high amount of fat, so these are also avoided. And full fat dairy products are not recommended because the patient has to use low fat dairy products like skim milk, low fat yogurt. And processed foods are not recommended, and cakes and biscuits may contain the white flour, also contain white flour, and creams that are not recommended for the patient. So the conclusion is that patient has to follow the low fat diet, high fiber diet, and plant based foods and good fats. So thank you so much for watching, and please subscribe my YouTube channel for more information and for disease management by diet. Thank you so much.